Hello and welcome to the Friday, April 10th edition of the Daily Situation Report for Thunder Bay Regional Health Sciences Centre's COVID-19 response. My name is Tracy Smith, and I am here with our hospital's incident manager, Dr. Stuart Kennedy. Dr. Kennedy, this is a day we hoped would never come. A member of our hospital's support staff has tested positive for COVID-19. Our thoughts are with our colleague who is isolating at home, but we know that this will weigh very heavily on all hospital staff and professional staff. What would you like to tell them?
Yes, thanks, Tracy. First thing this morning, we were notified of a positive healthcare support worker who has had a number of shifts within our facility. And certainly at this point in time, our staff member is doing quite well. They've been contacted with the Thunder Bay Health Unit, as well as contacted with our own occupational health unit to obtain a history, look at potential contacts. But certainly at this time, I'd like to reassure the hospital staff that the exposure to other staff and patients is very minimal with our initial investigations, which will continue. And certainly, this is not unexpected. We know in some case reports, 30% of healthcare workers can get this disease transmitted to them. The vast majority have a good positive outcome. But this, again, heightens the anxiety with our hospital workers, with our healthcare workers in all facilities, not only here at Thunder Region Hospital, but certainly throughout other long-term care facilities and other sort of facilities in northwestern Ontario. So it's a difficult reality, but it's something we have, again, prepared for. We knew it was going to be inevitable. It does not make our job any easier. But certainly, we are again prepared for that. The healthcare workers, I did a round review this morning of the emergency staff, our ICU staff, our 3A staff. We're going to open the COVID unit, and again, there's a quiet confidence among all staff members that the team is ready, and we're ready to accept more COVID-19 patients, and we're also ready to for any challenges that we are faced with. They're going through ongoing education, and there certainly are significant manager presence here in the units today and throughout the weekend and throughout the next several weeks, which again leaves confidence to all the staff that we are providing support, which all our staff needs at this time. We had the one confirmed healthcare worker. We also had another positive community case also reported this morning, but this case had a travel history, okay, and that case is also doing quite well at home. So at this point in time, it's proceeding with our plan, our pandemic plan, that really is following the process the way it should.
Okay, thank you. So you're talking about cases in the community. We know that a person in the community confirmed positive works for a local grocery store, and people are becoming concerned. What can you say to the people in the community?
Nothing more that we've already been telling the community members is that certainly in all grocery stores are doing all their due diligence themselves with the 2-meter distancing, with only allowing a few members of the public in the store at a time. So everybody's doing their job. So what has happened? It's inevitable. We know there's COVID-19 in the community, so it continues to do the same things. Wash your hands, wash your hands, wash your hands. Be vigilant when you're going out to obtain necessary supplies. Make sure you keep the 2 meters apart. If you can't keep 2 meters apart, wear a face covering or a facial mask that will help you spreading to somebody else. So again, not unexpected. This just tells you we maintain our due diligence in the community. And I think as long as we do that, I still am confident we can actually continue to only have a trickle of patients in the hospital to protect our healthcare workers and also protect our patients here at the hospital.
Great. And we need to remind people to practice kindness during these times.
Absolutely.
What is the situation here in our hospital?
So as we reported yesterday, we had 3 confirmed cases in our hospital and 18 presumptive cases, and that's why we're getting ready to open up a new unit on 3A, a COVID-19 specific unit. We had one of those patients discharged yesterday in improved condition. We do have one in the intensive care unit suffering from COVID-19. This individual has other what we call comorbidities or illnesses on top of the COVID-19, but this patient is not ventilated, and so certainly is stable, but fragile at this point in time.
Okay. Speaking of the dedicated COVID-19 care unit, there have been some questions in the community about that. Maybe you can help to clarify. So first of all, why is that unit only being established now?
Yes, I mean, I think quarterbacks get this discussion all the time, actually. Every sort of will challenge, the decisions being made. But the decisions are made in a very calculated format based on our pandemic plan and based on epidemiological studies, what we expect the spread in our community is going to be and what numbers of COVID-19 patients we expect over the next 2 to 4 weeks. So based on that plan, as we have set aside 36 units at this point in time, beds at this point in time to prepare, and we hopefully that will open on Monday as we sort of prepare the whole weekend. But we have another secondary plan to expand to other units, and certainly that will happen as the need arises. We're also got plans, if we ever get overwhelmed, to begin looking at, or we're looking at right now, the possibility of a field hospital that would have a team working on that right now, depending on the volume of patients we get. We are quite confident we're not going to need that field hospital, but we have a plan that we put in place. We have a team of, I said, all 150 leaders working on all these portions of the plan, so we are prepared. We'll take criticism, but from my perspective as leader of the team, at this point in time, we are prepared for any volume of patients that we need to deal with for COVID-19 in this community and this region.
So elements of the pandemic plan are phased in based on evolving situations.
Well, absolutely. We can't really disregard the other healthcare needs in the population. I mean, as I stated previous times, I mean, we still have patients falling ill from trauma, from heart conditions, from lung conditions, from cancer conditions. We need to take care of that population too. So we just can't empty out this hospital and not provide timely medical care. So this has to be a staged approach. So we actually are prepared both for COVID-19, but also taking care of the needs of Thunder Bay and the region.
Speaking of that, the emergency department, people still need to access emergency department for urgent needs. At the same time, a COVID-19 hot zone. Can you tell us about activity in the emergency department right now?
Yes, when you go to the emergency department now, you'll be screened. If you have a positive screen, you will be put into what we call a hot zone, where all members will be gowned in gloves, gowns, goggles, as well as face masks. And you will be asked to stay in that hot zone so you don't contaminate anything else in the hospital or other workers in the hospital. The emergency nurses and physicians will also be sort of delegated to that one area hot zone with very limited and hopefully we try no sort of travel to what's called the warm zone. And they'll be taking proper PPE precautions. But I must say we need to also balance the proper PPE precautions and gowning and taking off your PPE with the balance of we only have so much supplies. We still have to preserve our supplies. But certainly all the infectious disease protocols are trying to be maintained. We may need to adjust them a little bit based on the risk of the population, but certainly we are trying to actually have enough PPE to be available when the condition arises.
Okay, thank you for clarifying that. I want to turn things to our COVID-19 testing. As of yesterday, we had performed a total of 475 COVID-19 tests at our hospital, in the assessment center and in the hospital here. I know you want to increase that number. You're prepared to conduct more testing. Daily numbers have increased a little bit. Can you tell us what is the progress?
Yes, thank you, Tracy. We need to increase the testing, and that's an absolute statement, because we have not been doing enough testing based on travel. We need to know the prevalence in the community. We need to take care of our long-term care patients as staff. We need to take care of our retirement home staff and patients. We need to take care of our hospital workers. We need to take care of our first responders, which includes police, fire. So we need to increase our testing. So we expanded our criteria to treat all symptomatic patients with 2 or more of the criteria, which includes fever, chest pain, shortness of breath, diarrhea, fatigue, nausea, and those are general statements, but that will increase the amount of testing required. And as of yesterday, we had over 50 tests performed compared to probably 20 the day before, and we plan to increase the testing at the assessment center to 80 to 100 as the need arises. So we're ready to do more testing. The fragility is that still are being sent away to Toronto, but the turnaround time has come down to 2 or 3 days now, which is good. We still need to do our in-house testing as a priority. I need 2 to 4 hour turnaround time, not 2 to 3 days turnaround time, and so does the community. So as leaders, we have elevated this to the very senior levels of both the federal government and the provincial government to make sure we get the supplies we need. We have the technology here. What we need is the test kits and the reagents to validate the swabs and making sure that we can do the in-house testing. I'm confident we're going to get these reagents in, and I'm still confident that we can actually, by the end of next week or the following week, have in-house testing. But we have to be reminded there's a world demand for these supplies and a Canadian demand. But I think at this point in time, we are pushing every button we can to do in-house testing, because it's going to make such a difference for the safety of our staff as well as the decrease the spread in the community.
Well, we're very fortunate to have the support of our health system partners and our political leaders in that effort. So,
Yes.
thank you. Our thoughts today are with our colleague and everyone who is impacted by COVID-19. Be safe and be kind. Thank you.
Thank you.